So I fell in love with labor and delivery because you have mostly happy times in labor and delivery, but also like you get to welcome the new babies into the world. You get to share the special bond with the families.
Welcome to Experience Armymedicine Interviews. Our mission is to interview local medical professionals within the Army so they can detail their impact in medicine today. Today's interview is with Major Regina Velasco, 66 Golf, OB-GYN Nurse. She hails from Weed Army Community Hospital, Fort Irwin, California.
Regina Velasco, rank is Major, and my AOC is a 66 Golf, OB-GYN Nurse. So I am born and raised in Hawaii. I went to nursing school. I got my bachelor's, and then I tried to get a job as a new grad in Hawaii in the hospital, but unfortunately they wanted 2 years of experience, and without having the opportunity to actually work in a hospital, it was really difficult to gain that experience. So I worked in home health, had a lot of roles as a home health nurse. Then I was like, well, I'm tired of working all these hours without even actually gaining the experience that I need to work in a hospital. So I decided to commission. So I was a direct commission into the Army in 2008. And I went to Officer Basic in 2009, October. Then my first assignment was Fort Hood, Texas. I was devastated that I had to leave home for the first time. And the Army wouldn't keep me home for my first assignment. But no regrets. I just kept going. I thought I was only going to do 4 years, or my commitment was 4 years and get out. But here I am, have my 15-year anniversary in October. Make it to the end, hopefully to retirement in the next 5 years. So throughout nursing school, I just went through clinicals, and I was like, I think this is what I want to do. I went through the clinical nurse transition program, which they put us through 6 months of basically orientation to different areas of the hospital. And so I had the opportunity to go to labor and delivery, and then mother baby and med surg. So I fell in love with labor and delivery because you have mostly happy times in labor and delivery, but also like you get to welcome the new babies into the world. You get to share the special bond with the families through their happy times and their sad times. It's the whole family aspect, and you get basically every part of nursing all in one. So we have triage, so we serve as the OB-ER. We do med surg here because pregnant patients come in with different types of illnesses. We're an ICU because we recover our patients after surgery, or if they're critically unstable, we take care of babies. So we have that aspect. So it's just a whole package all in one. I didn't really have necessarily a favorite duty location. I just make the best of whatever assignment I'm given. It was nice to be in Germany. So I did 3 years in Germany at Landstuhl. It gives you the opportunity to travel Europe, and you get to see a wide variety of patients there. It's a joint base, so you get to work with Air Force and Army there. There's a few Marines and Navy there, but in the OB field, you don't really work with them. But yeah, so I guess I could say Germany, just because of the extra travels that you can do. Armymedicine, you become proficient at your job. But you are a soldier first. So coming into the Army, you have to have a flexible mentality, being a go-getter, wanting to strive for goals, not just staying focused in your area of expertise as a nurse, but being flexible in an aspect of always making sure you're soldier ready, taking care of yourself and your family, but also have fun while you're working. Transitioning from Army to civilian medicine, I mean, you get a lot of experience serving in Army medicine. Outside in the civilian world, so I had the opportunity to do a broadening assignment, and I was a brigade nurse for the 1st Stryker Brigade at Fort Carson. When you assume the role as a brigade nurse, if you are a specialized nurse with an identifier, you revert back to a med-surg nurse, so which is a 66 hotel, and you function in that capacity. It doesn't mean you won't encounter situations that encompass your specialty, but that's just how it works, is that you kind of revert back to a 66 hotel and you work within that aspect. I had the opportunity to deploy with the unit to Jalalabad, Afghanistan, where we were a Role 2 co-located with a forward surgical team. And so as a brigade nurse, you have the capability to augment the surgical team, which they primarily react to the traumas that come in. So you're basically like the second hand of the primary nurse of that team. And I mean, getting in there and trying to do the best you can to expose yourself to different experiences. Being a 66 Golf is like way outside of what my comfort level was, but it definitely encouraged me to build my skills and confidence to take care of patients outside of my comfort zone. I did. One of my nursing school colleagues actually joined the Army before me, and so she's like, hey, I think it's a great opportunity. And so I said, well, I'll keep your name in the back of my head and I'll reach out to you when I'm ready. And so, months have gone by, and then when I was ready, I reached out to her. She linked me up with the recruiter, and I went to the office, got some information. Then I was like, okay, I'm going to do it. And I did.
Thank you for listening in on our Experience Army Medicine interviews. We hope that these interviews help encourage your own path into a healthcare career. If you enjoyed the interview, please don't forget to like, follow, and share our content as we continue to dive deeper into Army medicine. Be all you can be Army medicine.